I'm Dr. Shens from Shens Clinic. Welcome to another episode of Ask Dr. Shens. Our technique of double eyelid creation differs from other clinics. We use a combination of weaving, knotting, and twisting. By using three different techniques in a single procedure, we are now able to achieve a more permanent kind of double eyelid creation. This technique is essentially very unique to us because it's actually an amalgamation of a couple of techniques I've actually looked at over many years. I find that this technique actually gives a very permanent as well as a very natural kind of double eyelid fold. In assessing suitability, we consider a few factors, namely whether the patient has loose skin, whether the patient has a lot of fats in the upper eyelid, and we take into account the position of the eyebrow as well as the eye shape. Looking at all these factors, we then decide for the patient what the suitability of the double eyelid fold would be. Essentially, we determine the height of the double eyelid crease. We then discuss it with the patient and show them some examples of other patients who have had similar procedures, and occasionally we also add some other adjunctive procedures such as widening of the eyelids either on the inner portion or the outer portion of the eyelids. The typical recovery of a double eyelid procedure is actually pretty short. In fact, most patients will be thinking that the eyelids are going to be swollen for a month or more. But with the stitching technique that we employ, we are now able to cut that down quite drastically to just about a week. Within a week, most patients are able to return to work, albeit with a slight swelling, but it can be camouflaged with a bit of concealer or occasionally just with a pair of spectacles that a patient can wear. The risks, as in the downtime, usually is just swelling or bruising. In fact, even the scars of a double eyelid can be concealed very effectively, and over a long period of time, the scars are not even visible. I hope you enjoyed the session so far. Please feel free to pop by for a private consultation if you would like to know more.